Welcome to Occupational Health and Safety Vulnerability of Recent Immigrants and Refugees. Thank you for joining us today. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness and Disability Prevention Institute, and I'll be moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to WWDPI. We thank our program partners, Canadian Council on Rehabilitation and Work, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We will collect questions submitted throughout the presentation and follow the presentation with a Q&A based on the questions submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website along with the slides. You will be emailed the direct links for all of these items when they're available. Today's presenter is Dr. Basak Yanar. Dr. Basak Yanar is a research associate at the Institute for Work and Health. She holds a PhD in organizational behavior from the Rotman School of Management at the University of Toronto, where her research focused on labor market experiences of immigrant professionals in Canada. Basak's research examines safe work integration of newcomers and how organizations can promote the physical and psychological well-being of their employees. With Dr. Peter Smith, she's currently leading a qualitative research project on the role of employer and settlement organizations in work integration of recent immigrants and refugees in Ontario and staying safe at work. Basak, it's an honor to have you on air with us today. Thank you. I think we're all ready to learn from you. So without further ado, I will hand it over to you.
Thank you, Yusra. Thank you. Thank you very much, first of all, for having me here. And I'm very happy to be presenting our research on the occupational health and safety vulnerability of recent immigrants and refugees. So first of all, I would like to acknowledge our research team here at the Institute for Work and Health, especially Agnieszka Kosny, who was the lead researcher in safe employment integration of immigrants and refugees, as well as Dr. Peter Smith, who leads research here at the Institute on Occupational Health and Safety Vulnerability. So this study today, the study that I will be presenting to you, is actually a part of a larger project that we conducted here at the Institute on work integration of recent immigrants and refugees, and the key resource needs to safely integrate newcomers into the labor market. But what I will be doing today is to give you a little bit of a background. I will kind of bring together two streams of research that we are conducting here at the Institute on recent immigrants and refugees, safe labor market integration, and also research on understanding the occupational health and safety vulnerability, which is mainly identification of workers at increased risk of injury. So Institute for Work and Health has a long history of doing research with vulnerable workers. Our early research mainly focused on workers who are new to their jobs, new to the labor market, and our later research focused on precarious employment and understanding and measurement of occupational health and safety vulnerability. So before I start talking about the study that I will be presenting, I just want to give you a little bit of an overview of some of the key findings from the research that we have done over the years, especially around labor market integration of immigrants and refugees. So we know that being new to a job, regardless of age, has impact on the incidence of work injury. So people who are new to their jobs, especially in their first few months, are at a higher risk of injury. And workers who are recent immigrants are they're doubly new. So they are new to Canada and new to their jobs, so which may increase the risk of injury and illness on the job. And we know that although immigration is a key driver of Canada's labor market growth, newcomers often face challenges that restrict their access to quality employment. So this could be due to language barriers, the evaluation of their foreign credentials, or employer hiring practices. So in light of these challenges, compared to Canadian-born workers, immigrants and especially recent immigrants and refugees, are less likely to work in jobs that match their educational level and professional experience. So this precarious situation can also have implications for occupational health and safety. Recent immigrants and refugees are more likely to work in physically demanding jobs. In temporary contracts, they might hold a few different jobs, work longer hours, and they are more likely to be exposed to hazardous work, which increases the risk of injury. And also we know that recent immigrants and refugees are less likely to receive training and have knowledge of occupational health and safety and worker rights. Employment-related resources for newcomers often do not include information on health and safety, including what to do if you get injured. So in order to understand immigrant workers' experiences, due to increased risk of injury, immigrant workers are usually labeled as vulnerable workers. So most of the research in occupational health and safety literature focused on migration and sociodemographic factors, or the occupation and industries that immigrants typically work in to understand the vulnerability of immigrant workers. Workplace context has been increasingly recognized as a modifiable driving factor of occupational health and safety vulnerability. So I will talk a little bit about this framework that I will be basing the study on and findings of the study that I will be presenting. So researchers at the Institute for Work and Health has been developing a new way to understand occupational health and safety vulnerability that can identify workers who are at risk of injury and factors that can increase this risk. So focusing on the context and workplace circumstances, there are 4 dimensions that I would like to focus on that lead to increased risk of injury at work. So the first one is the level of hazard experienced by the worker, in combination with workplace policies and procedures to protect workers, worker awareness of hazards and rights and responsibilities, and worker empowerment to participate in injury prevention. So in this framework, we look at the vulnerability as exposure to hazard with inadequate protections for the workers. When we talk about inadequate protections, it could be inadequate policies and procedures in an organization to protect workers, inadequate awareness of rights and responsibilities, and inadequate empowerment to participate in injury prevention. So I'll talk a little bit of these factors just a little bit more in detail. So the first dimension that we talk about in occupational health and safety vulnerability is the exposure to hazards. So these are working conditions that have the potential to cause injury or illness to workers. So these could be exposure to hazardous substances at work, working with dangerous tools and equipment, working in awkward positions, performing potentially injurious tasks, being exposed to dust or chemicals. Or it could be psychological hazards such as being targeted as in harassment and bullying. When we talk about occupational health and safety policies and procedures in a workplace, we talk about protections, occupational health and safety protections and policies that protect workers from exposure to hazards and other workplace risks, such as, for example, as a worker being given proper safety equipment to do your job, or as workplace procedures, identification and controlling of hazardous substances, or replacement of a defective equipment. So these are the things that policies or procedures and practices within the workplace to protect workers. An occupational health and safety awareness, which is another dimension of the vulnerability framework, is about awareness of safety hazards in the workplace or knowledge of occupational health and safety rights and responsibilities. So these could be individuals can become aware of safety hazards in the workplace through proper training, proper instruction, and individuals can learn about their rights and responsibilities through formal or informal training in the workplace. And lastly, occupational health and safety empowerment. This refers to the extent to which individuals feel free to voice their concerns, questions around health and safety, and feel free or secure enough to refuse unsafe duties or being able to report certain hazards, or when they find themselves, in order to be able to speak up when they find themselves in a situation where they do not feel unsafe. So the Occupational Health and Safety Vulnerability Framework basically defines vulnerability as exposure to hazards in combination with inadequate access to these three protections: policy and procedures, awareness, and empowerment. So when we talk about vulnerable workers, the ones who are most vulnerable are basically individuals and workers who are exposed to hazards in the workplace and not have access to proper policies and procedures such as protective equipment, or they have inadequate awareness of occupational health and safety, or have to safely perform their job. And they have inadequate, or they are in an environment that does not foster empowerment in a sense of speaking up when somebody sees something unsafe. So as I mentioned, I will be presenting a study that was a part of a larger project that we looked at the work integration of recent immigrants and refugees in Canada. The objective of the presentation that I'll be looking at today is to examine the experiences of recent immigrants and refugees who were looking for work and in their first jobs in Canada through the Occupational Health and Safety Vulnerability Conceptual Framework. So just a little bit about the study. We conducted focus groups with 110 recent immigrants and refugees in Ontario, Northern Ontario, Eastern Ontario, and Southern Ontario, who were looking for work, or who were currently working, or who have had work experience in Canada. So we conducted 18 focus groups, and 13 of these focus groups were in English and 5 were in Arabic. And we collected the data, as I mentioned, in GTA, Eastern and Northern Ontario. And focus groups mainly lasted around 1.5 hours, with usually from 4 to 10 focus group participants in each focus group. And our discussions mainly focused on the participants' experiences about their job search process. So how did they prepare for employment? What kind of work-related resources or supports they accessed? Knowledge about their rights, occupational health and safety, and also we have spoken to them about their experiences in their first jobs. We mainly recruited our participants through settlement organizations, community groups, and community groups and their ethnic connections. So most of the participants actually who have participated in our study used some form of, were provided some kind of a training, employment preparation, or language training. And we recorded all of the focus groups, and they were transcribed verbatim, and the Arabic ones were translated. And as the research team, we read all of the transcripts, we coded our data, and in order to identify the themes, patterns, and gaps in our data, we used a thematic analysis. So we adopted a qualitative approach. And for this particular study, we did a second analysis to organize and map the themes that came out in our data onto the dimensions of the Occupational Health and Safety Vulnerability Framework. So who were our participants? So our participants were recent immigrants and refugees. They were almost 70% of them were in Canada less than 2 years, so fairly recent group. And they came from different immigration streams. The majority were through economic and they came to Canada through economic and humanitarian streams. But we also had individuals, spouses of economic immigrants, people who came through family sponsorship, and also individuals who were here on a temporary status. So almost close to half of our participants were from the Middle East, and but also we had a good representation from different parts of the world, such as Europe, Southeast Asia, South America, and Caribbean. And 50% of our participants were women. They were quite a young group, so 43% of our participants were younger than 35 years old. A highly educated group, 73% had some university training, and they came from very diverse professions from their home countries. People were engineers, they worked in education, skilled trade, business, and health. So we saw a very diverse group of people. And at the time of the focus groups, 31% were employed, but most participants reported having had some work experience in Canada. Almost most of the people had work experience in Canada through volunteering, through short contracts, or casual work. So they were able to speak to experiences in the workplace. So just to give you a quick snapshot of how people found their jobs, first jobs in Canada. So almost all participants reported difficulty finding work. So they talked about language barriers, or they talked about employers' requests for Canadian experience. So they would go into an interview and they would be asked if they had Canadian experience. And lack of recognition of foreign credential, and this was especially true for refugees. We had Syrian refugees in our group of people that we spoke to, and it was very hard for them to be able to even access the institutions in their home country to get their foreign credentials and getting them recognized. So that was a big challenge for a lot of people, especially ones who are trying to get into some professional work. So sending out resumes it did not yielded very low success. So most of our participants talked about getting their first jobs through family, cultural, or community connections, and some got their first jobs through settlement organizations. People talked about being engaged in volunteer work as their first experiences in Canada as well. So as I mentioned, the group that we spoke to, the participants were coming from very diverse professional backgrounds, but their first jobs in Canada were mainly concentrated in manufacturing, customer service, construction, trade, domestic help. And these were temporary contracts. People talked about being paid low wages, and some people talked about being paid cash only, with poor working conditions and lack of health and safety training. So now looking at, so when we looked at our data and we wanted to try to understand from these 4 different dimensions of the occupational health and safety vulnerability framework. So one of the things that we found was most of the times the kind of jobs that people did in their first jobs, such as in manufacturing, being worked in a factory, they had little, these were new working conditions for them. So they had little knowledge of performing these tasks. So people talked about, for example, working in a manufacturing setting or a food processing plant or construction for the first time. So they were in new working conditions. They found themselves working in the cold for the first time. So they were using new tools and machinery, new kind of work. So, so that kind of posed a challenge because they were exposed to different kinds of hazards that they were not familiar with. So, for example, participants talked about working in a packaging or assembly line at a high pace, lifting heavy loads, working with chemicals, working in the cold for hours, or standing up for prolonged time. And some also talked about some psychological hazards, for example, being yelled at work, and those kind of experiences. So I just want to show a few quotes from our participants. So this is a participant who are currently working in a she was there. They were currently working in a manufacturing plant, and I'm new and I don't work in the labor. I've been working in computer in my country. It's different from I have experienced to different work. And when I come, people is not perfect. And when they are, do that, okay, I will do it. And one day I'm working in the big cold fridge. So this participant was talking about being finding themselves in a completely different work situation than their own profession, which was mainly working with computers in an office work. And now they are working in a manufacturing plant in a cold environment. Another participant working in a factory. I work in factory. I came here, after I came here, maybe for 3 months or 4 months, I was working in that, picking the package, the cartons, and keeping in the skids. And I told my supervisor, it is very heavy and the job without people. I am just one. And now I have a problem in my back. So these are just 2 examples of people sharing their stories about the kind of work environments that they found themselves in. And when we looked at the participants' responses or what they were talking about in terms of their workplace experiences, in regards to protections and procedures within the workplace related to keeping them safe, we found that only a small number of people actually reported being provided with job-related training or formal job instruction. So some given instructions by a supervisor or a co-worker after they started on the job, and few participants reported being provided with proper protective equipment by their employers, and some actually talked about buying their own protective equipment to prevent to protect themselves from the chemicals or the dusts that they were exposed to. So again, as I mentioned, these were the new jobs for them. They did not have experience in, however, only a small number being provided by proper job-related instruction. So there were examples of workers performing jobs and using tools without protection, being asked to heavy carry loads without proper equipment. Actually, I would like to show you a quote from a participant who was working in a construction area in the winter, and he was asked to move metal equipment in this construction area. So it says, it was in the winter, it was 11 degrees below zero, but the wind chill made it 19 below, and we were working outside. I didn't have the right gloves, so my hands were freezing. I mean, not that I felt like they were freezing, I mean they were freezing. I went onto the opposite side of the road in our break time and went to where I knew there was a public laundry. I went in and put my hands on the dryer. It took about 15 minutes for my hands to thaw out and the blood to circulate again. So this worker felt that it was actually his own responsibility, not the employer's, to make sure that he had protective equipment when we probed further. And when we asked whether he requested the right gloves from the employer, the worker said that he did not ask for them. He thought that it was his responsibility. And what he did is he went on a mission to go and find the right gloves, which he wasn't very familiar with in terms of what would protect him in that cold. Another example was in terms of the policies and procedures within the workplace. We have also, it was apparent that it was sometimes common practice that people did not use protective equipment or did not follow safety regulations. And this is an example from a participant who was working in a pizza shop and seeing that everyone else is doing things that are unsafe. You do it because you see even your employer doing it, and because he's experienced, he can do it. I was not, so I burned myself. So in general, ideally, you're supposed to report to your supervisor, but when the supervisor himself is doing it, what are you going to report it to? That is the trouble in small businesses. Maybe in a big one, you will try and get something done. And interestingly, as I mentioned, usually people found their first jobs through their family and cultural connections. And these were in actually small businesses that are also owned by the individual's ethnic community, and they were immigrants themselves. So we heard that in small businesses especially, it could be hard for people to get this kind of training and also report, for example, if they find something unsafe, because there were a few times people mentioned that they should be feeling grateful that they have gotten this job, and that it would be very hard for them to bring up issues to their employer. And when we actually asked about what people knew about their workers' rights and responsibilities, or about occupational health and safety, most knew very little about the responsibility of their employers regarding the training and safety policies and procedures. Only a small number of the participants reported receiving occupational health and safety related training in their workplaces when they started. And some were talked about being given handouts by their employers or completing an online training, and only a few received in-person training. Most participants did not have much of a knowledge about their own worker rights, and also some talked about learning about these rights from their coworkers or from a supervisor as they were going on doing their jobs. And so they basically relied on some of the people that they trusted in the workplace. And an interesting piece, actually, what we found when we were looking at the data around understanding the participants' awareness of the rights, there was a degree of confusion regarding understanding occupational health and safety concepts. So, for example, when we asked about knowledge regarding rights at work, so for example, workers' rights at work, participants responded by listing their responsibilities. So, such as the things that they had to do in their job. Or when we asked, for example, whether they have received training materials in occupational health and safety or health and safety, they were talking about receiving information, but then when we probed further, this was signing a contract that outlined their responsibilities, or they were required to take a quiz by a temporary agency, for example, without actually receiving the training or the information to complete the quiz. Or some people talked about employment rights information from their own country and thought these applied to Canadian workplace as well. Or in a few instances, for example, people received some information around health and safety, but when we probed further, this was, for example, in an example of a person who worked in the healthcare sector, the injury prevention training was actually about how to keep clients safe, but was not so much about the worker safety. So basically, when describing their jobs, it was apparent that the participants were performing unsafe tasks, and without training, perhaps they may not be aware that they were actually performing unsafe tasks. So, for example, participants were talking about lifting heavy weight, but may not be aware of these hazards due to lack of this kind of training and understanding of what their rights and responsibilities are. So this kind of this quote is a good example of many conversations that we had with the focus group participants. The moderator asks, when you start a job, did they give you information? Did anyone tell you if somebody treats you badly, these are the things that you should do? No, nothing. So you just ignored it. Yeah. So this was from a focus group participant working in an industrial bakery. And this was a quote from a participant working in healthcare sector, which kind of speaks to what I mentioned in terms of the extent of the health and safety training that the participants received. What about you in healthcare sector? Anything you want to do if you were injured? I have experience I worked there. They told me we have training about if the seniors fall, but for me, first I think to help. But the training, if you can help, you help. But if you can't, you need to phone the ambulance to come to help. That's more for your clients. Anything about Though if you got injured, let's say you were helping a client and you were injured, is there anything about what to do if you were injured? And the participant says, I don't know. And in terms of the final dimension that we were looking at about the occupational health and safety empowerment, although many participants reported working in precarious or unsafe situations, most reported not speaking up to their employers about the hazards or injuries. So for example, some people mentioned working like in an industrial bakery and falling and not reporting, and only to find out that they would go home and then they would have a swollen ankle. So they were not sure about what to do in these kind of situations. And when we asked about the reasons for not speaking up, participants reported that they were new to their jobs. They have just gotten this job. They wanted to get the Canadian experience, so they did not want to ruffle any feathers. They did not want to disrupt their employment relationships. And especially the participants who found their jobs through a temporary agency or through even their own cultural connections, they did not want to damage relationships with their employer. For ones who worked in the temporary agency, this could mean that they would not be getting a new assignment. And for the others who have found their jobs through cultural or family connections, they just did not want to look ungrateful or damage their relationships. So the fear of losing jobs was very significant. And also, in some instances, we heard that people did not speak up because of the language difficulties. So we had a few examples of individuals who injured themselves on the job, and they did not even know if they should go to the doctor because they were not sure if they would be able to express themselves. And I think language difficulties prevented them from saying something. And in a few instances also, people did speak up. However, a few participants complained about, for example, unsafe working conditions and told their employers about the injury. And what they found is the employer became aware of it, but nothing came out of it, or they were reprimanded. Interestingly, when we asked people in the instances that they told us that they felt like they were lifting too heavy of equipment, or they fell or they injured themselves, we asked them what they did. They were, in some instances, they were let go by the employer, but in a few instances, actually, we heard that people just left their jobs and they did not go back. So that was a very interesting finding. And participants had little knowledge of what to do after injury and reporting process. So not much of a knowledge around the process around if you got injured, who you should speak to, or very little knowledge of the Workers' Compensation Board or reporting process. So this was very evident in our conversations. Yeah. Just a few quotes again to illustrate the point. A focus group participant talking about the reason why they do not speak up. Because we don't want to say, because we don't want to make trouble, also for ourselves too. Because if we make too much trouble with this company, maybe it will be hard to be hired at some other company. This is one thing. We're newcomers, we're scared. And the other thing, for hurt, it means it's a dangerous thing. The company never wants you to say, never to say it's a kind of danger for them. And another participant who was working in a food processing plant, talking about working in a cold environment and not feeling good, but still not being able to do much about it. I'm working at the freezer and I stay for 8 hours, no giving us a break. I feel sick one day, sick like I can't breathe, and the cold. One day I passed out, don't feel good, and no sitting in the room, nothing. Somebody came in and told me, you better not say words. You're not allowed to talk. You're not allowed to talk. You talk to the next person. we change you for another department. So these kind of quotes really illustrate the situation that most newcomers, recent immigrants and refugees that we spoke to found themselves in. And of course, there were examples of participants who found themselves in good working environments, but those were not the norm, but mainly outliers in our focus group conversations. So what we found is most newcomers in our sample, in our group, focus group conversations, experience multiple forms of vulnerability. So they spoke about working in poor working conditions and working in unsafe situations. They did not have previous experience related to their first jobs and were performing physically demanding jobs for the first time. So being new to their jobs and being new to their Canadian environment contributed to lack of the safety knowledge. And this was coupled with without inadequate policies and procedures related to occupational health and safety. So as I mentioned, it was rare. They talked about not being provided personal protective equipment. Some went and bought themselves their equipment just to protect themselves, or they may not even be aware that that's what they should be using. And this was especially apparent in workplaces where they were a little bit smaller workplaces that they found themselves in, where this could be some common practice within the workplace. They had limited knowledge of occupational health and safety and workplace rights. And participants, when they were talking about their experiences, there was discomfort in questioning the working conditions or reporting safety hazards. So as I mentioned, being new to the host country and to their jobs, recent immigrants and refugees may not be fully aware of the safety risks in their jobs and may not have access to information regarding worker and occupational health and safety rights. Actually, as I mentioned, this was a part of a larger study, and in this study we also looked at the employment preparation process of recent immigrants and refugees, and where they receive information about workplace rights or occupational health and safety. So most of our participants went through some kind of an employment or language training, employment preparation training, and we asked them about whether they have received in these programs information about health and safety or worker rights. Many did not receive this information, and one of the things that we found was when this information was provided to participants, it was usually on a one-off basis, and it wasn't a part of a regular curriculum. So people, for example, for this larger project, we also spoke to service providers and settlement agencies, and they talked about these kind of information sessions being just one-offs, but not a regular training, and referring their clients, newcomer clients, to websites or providing them with handouts and pamphlets. So, and this may not be actually a very useful or accessible way of newcomers accessing this kind of information. And in terms of the workplace context, as we know, under the Occupational Health and Safety Act, the employer has the biggest responsibility to provide workplace training, health and safety training. Few participants were given adequate training. So in terms of looking at the experiences, the workplace experiences of recent immigrants and refugees in their first jobs, it shows us that rather than focusing too much on the individual factors, when we look at the workplace factors, these are the conditions that can be improved. So for example, there was one participant who talked about a positive experience where they started their job and they have received training. Yeah, the job that I was previously doing had done nothing, which resulted in many hazards. But the job I'm doing right now is through a company called, company name. So they had given it proper training. They give you training before, they train when I started the job, and there's an ongoing job training too, which when I'm doing something wrong, they keep on reminding me that this is the way to do it. This job has been great, but the previous experience is really bad. So in this quote, the participant was able to tell the difference between the previous experience that they had in a different job, and then they felt that they are properly trained in this new job, and they spoke about this experience positively. So what are the possible solutions? So we basically, in terms of focusing on the workplace factors such as proper procedures and policies in the workplace, proper training, or cultivating a workplace that fosters a safe sense of safety about voicing an opinion. We basically think that it is important. These are factors that can be, if adequately accessed, these protections can really help keep immigrants safe in the workplace. So one of the important things is to ensure that newcomers have access to knowledge and training in occupational health and safety, because as I mentioned, most of the participants in our focus group knew very little about their rights and knew very little about health and safety. So we think that, for example, and knowing that they did not receive this information in their workplaces, offering occupational health and safety content as a regular part of employment or settlement programming could be a solution. So because most of the times settlement agencies or these kind of programming is the first point of contact for a lot of newcomers in their journey to labor market integration. And having this kind of knowledge, accessing this kind of knowledge may actually help them become aware of what to look for in terms of, like, assess their workplaces and know that they have these rights in terms of right to know, right to participate, right to refuse unsafe work. But of course, I would like to be careful in terms of saying that we just need to give this information to the workers, and this should not put the onus of responsibility on the workers. But we understand that in these workplaces, participants did not access to adequate policies and procedures to protect them. For example, safety training, for example, protective equipment, or they did not find themselves in an environment where they were able to speak up. And these require a deeper understanding of some of the system level barriers of why, for example, safety training is not provided in the workplaces. So I think for policymakers, for regulators, and for researchers like us, understanding the system level barriers to successful implementation of mandatory training in the workplaces or system level programs related to occupational health and safety is important, because we know that since July 2014, there is all of the workplaces in Ontario has to provide mandatory basic occupational health and safety training to their new workers. However, very few of our participants talked about receiving this kind of training. So it's important to understand why, what are the barriers to implementation of these trainings. So one of the things that that could be plausible is, as I mentioned, these people, the participants found their first jobs in small businesses that are also owned by immigrants. And there could be an information gap on the side of the employers as well. So they may not have the necessary knowledge or the resources in creating a more health and safety management plan, or about keeping up with the legislative changes or mandatory training. They may not even be aware of these. So a part of the solution could be educating the employers as well. And of course, in terms of making workplaces safe for newcomers, proactive targeted inspections and audits by the regulatory bodies that focus on the industries who hire immigrants, it could be a potential solution. Identifying industries where there is a high concentration of immigrants and conducting proactive and targeted inspections is important. And as I mentioned, interventions to improve first job safety for newcomers, especially in small businesses, is important. So interventions could be education, interventions could be or proactive inspections to help also and to support employers in creating a safe workplace, and at the same time finding those who are not providing safe workplaces, or who are not keeping their workers safe, is important as well. So I think one thing that I would like to talk about is looking at the vulnerability of recent immigrants and refugees from the perspective of the workplace context. So when we can look at it from that perspective, we can identify some conditions and some areas where researchers, policymakers, or employers, regulators can focus on to improve the conditions for safe employment of recent immigrants and refugees. I think that's pretty much what I would like to say. I provided some references to those who are interested in reading a little bit more about some of the research that's done, especially around injury rates among recent immigrants and refugees, and some of our own work at the Institute for Work and Health, Occupational Health and Safety vulnerability and safe employment integration of recent immigrants and refugees. So I'd like to thank you.
Thank you so much, Basak, for this informative and compelling webinar. So right away, we'll start our Q&A session. To our attendees, if you have any questions, please insert them in the question box, and we'll start with our first question. In your slide number 12, where do recent immigrants and refugees fall within the vulnerability framework?
That is a very good question. I think I'm just going to go back to that that slide. Just let me quickly do that.
Sure, thank you.
So because I think this just to show that the most vulnerable are the people who are exposed to hazards in combination with inadequate access to these protections. I think one good way of looking at the issue with this framework is not every immigrant and refugees are going to be having the same experience, or they are going to be falling on this the bottom right quadrant of the most vulnerable. So in our study, actually, we found that they face multiple forms of vulnerability, such as exposure to hazards, and then they did find themselves in work environments that they actually doing unsafe things without protections and with little awareness. So in our study, we found that they're somewhat in the vulnerable category. But I think the key point here is there could be two recent immigrants, maybe even facing language barriers, or they may be in environments where they are exposed to hazards. But if a worker A, is in a workplace where where they receive proper training, or they are provided protective equipment, and they are, for example, buddy up with supervisors who are able to train them on the job, or they are being provided supports to keep them safe on the job, it will be a very different experience than an immigrant or a person B, let's say, who do not enjoy these protections. So I think that the point here is, as it is right now, what I would like to mention, what I would like to bring forth is there are vulnerabilities that recent immigrants and refugees face that can be changed, and that are stemming from the work environment, but these can be changed. But I think the reality of what we saw in our study was they were mostly in the bottom quadrant.
Thank you for your answer, Basak. And the next one, and I think you've mentioned that already, but in Canada, what kind of work opportunities are offered to recent immigrants and refugees who are highly skilled in their home? Are high-skilled workers matched with employment that translate their skills?
Wow, very good question. So I can speak a little bit about the research that's been done in this area, and also from the perspective or the experiences of our own participants from their own firsthand experience. So I'm also actually doing another study right now that we are looking at the issue from the perspective of the employers and service providers as well. So especially people who are coming, highly skilled workers, they do face barriers in getting jobs that are in their professional field or commensurate with their knowledge and experience. So one of the things that we have seen in this study is we had a highly educated group of people with professional experience, but it was very hard for them to find jobs in their professional field, especially if this was a regulated profession such as law or human resources or, for example, education. So what happens is they usually try to get a job, and the first experiences is usually in these precarious conditions. So it is a problem, and there are certain programs in Canada, such as bridging programs, to kind of help professionals, especially highly skilled professionals, to have an easier transition. However, in our research, when we spoke to people, it was very hard for them to get a job, especially commensurate with what they were doing. So they ended up like and usually like, we hear these stories of people coming here and driving cabs, but it is true when you actually speak to people and they talk about their own experiences. Like we had people with professional experience who found jobs in, let's say, manual labor that they have never done before. So yeah, and I think there are programs in place, and this is a big focus for government programs and also some professional associations. But in our research, we have found that that was a significant challenge.
Thank you for answering, Basak. And then the next question is, so the quotes that describe work experiences for recent immigrants and refugees you have shared with us are really poignant. In the example of the worker working in the cold 19 degrees below zero, what options are available to a recent immigrant or refugee, legal options or not, to assure this employee's protection? So are there any steps that need to be taken by the employee, or steps taken in terms of awareness?
So, and I find that quote very striking as well, and then especially when we were hearing the story. So I think one of the things is we can talk about it from the perspective of awareness of rights, right? Workers' awareness, and then we can talk about it in terms of employer responsibilities. So we know that in Ontario, workers enjoy 3 basic rights: the right to know, the right to participate, and the right to refuse unsafe work. So, for example, in this in this example, it is very hard for this person to continue working because their hands are freezing. So, in terms of the worker rights, they could refuse. For example, if a person feels like it is not safe for them to continue working, they can refuse unsafe work. So it comes with the knowledge of the worker to be able to do that. And then also it comes with the comfort that the worker feels that they can actually refuse unsafe work. So it's very interesting because we do this research, but we find that it is this whole empowerment issue or knowledge issue, they go hand in hand, and it is a very complex problem in terms of how to solve this problem, right? So you can help the person to become aware of their rights, but how do you solve the issue of whether the person is willing to speak up or not? So that's a challenge. In terms of the employer responsibilities, employers are responsible to take any measures to keep their workers safe at work. So employer has the responsibility to provide the protective equipment. So I think in this story, when we were hearing it, the person was not provided equipment. They did not say anything to anyone. They went and go ahead and tried to find their own gloves. Perhaps they could be in a casual work situation, could be a contractor. So there's a lot of these issues in place. So that's kind of a challenge, but employers are responsible. And one of the things that can be done is, as I mentioned, understanding the systemic challenges to why employers are not providing these, let's say, a protective equipment. So there could be some proactive inspections in place to perhaps identify some of the employers that are like that. So, but one of the things that we are doing right now is we are in a new study speaking to employers and try to understand their challenges and their needs in employing newcomers and how to keep them safe, just to try to understand what are the dynamics there in terms of workplace protections. But it is definitely employers' responsibility to provide protective equipment and keep their workers safe. And it was a striking quote and just like a heartbreaking one.
Yes. So next question is, how can we better promote occupational health and safety awareness to this category of workers? So what are you aware of any interventions that are already in place? In your opinion, what needs to be done differently in order for them to be more effective?
Sure, and as I mentioned, this was a part of a larger study while we also looked at how newcomers find their first jobs, and they were usually, so we spoke to people who have gone through some kind of a language and employment programming. So most of the times, the first point of contact for a lot of immigrants is a language training in Canada, and also some kind of, when their language proficiency increase, employment programming. So we think that because we see that few of them received workplace training, we think that perhaps settlement agencies can play an important role, at least to provide this information to newcomers. And we think that, and this can be done in employment programs, employment preparation programs, but most of the times these employment preparation programs are for people who are reached a certain level of language proficiency. But we find that things don't work that way for newcomers. Like we had people, for example, refugees or newcomers with with low language skills, but they went ahead and they were going to maybe a language program, but they were working at the same time. So we think that providing this information as early as possible and as frequent as possible in a language, for example, it could be integrated into a language curriculum, right? Link programs, and it could be again repeated in a employment preparation programs. So that's one thing, and I think simplified language is very important. And for example, we heard from service providers that when their newcomer clients had a question, they would refer them to some kind of a website. So for example, there's Welcome to Canada guide, and there is Ministry of Labor's website. However, these are not very easy to navigate for newcomers. I mean, I find it hard to navigate those kind of websites with a sophisticated language. Or for example, we went and looked at the Welcome to Canada guide, and there wasn't much of a mention of occupational health and safety in there either. So it's like a few paragraphs. So I think that could be one way to provide this information before people are starting their journey into the labor market. And then also, I think what we are trying to understand is also now how employers what are their needs, for example, when they have a newcomer with a different kind of language proficiency or speaking a different language, how can employers, what can they do to provide this kind of information in a way that would be more accessible. So I think we have a long way to go in terms of making occupational health and safety information accessible in terms of language, and in terms of reaching people's access to this kind of information. I know that governmental bodies are trying to simplify their language, and perhaps there could be some, one of the things that actually we have talked about in this context of the larger study was having a champion. It could be a government body who could actually coordinate the dissemination of this knowledge to newcomers would be very, very helpful, actually. Yeah.
Makes sense. Thank you so much. And we'll just wrap up with our last question, Basak. So in your opinion, what further work needs to be done in order to improve recent immigrants and refugees' work conditions, whether it's more research, better practices, improve awareness? What are the next steps in particular of your study?
Okay, and I will tell this about like my own kind of like perspective as a researcher and a person who's also a like I'm an immigrant myself as well. So one thing I think is going to the root of the problem, which is, as I mentioned a few times, that people come here with very different kinds of skills and education, and then they end up in completely new jobs that are not matching their own experiences and professional background. So I think perhaps the root of the problem would be to understand how can we actually better create opportunities for new immigrants when they come here to be able to successfully transition to a profession that is somewhat related to what they were doing. So I think that challenge that recent immigrants or refugees experience in the labor market, and especially this is for people who are coming with certain set of skills, is very important. So there is this big systemic barrier, right? And then the other pieces I think we talked about, so I think that's very important. Because we know that occupational mismatch actually increases the risk of injury. So the higher educated person, and then if they are in a job that does not match their educational level, the research shows that they are in a higher risk of injury. The other piece is, as I mentioned, the awareness, and I think it is a good starting point because when we speak to newcomers and some other research projects as well, they come with very little knowledge about occupational health and safety, and they might be coming from countries or workplaces or cultures that might they may have a different understanding of safety or might have very different workplace practices around health and safety. So it is important to provide awareness around Canadian workplace and Canadian or their worker rights in Canada. However, having said that, my personal opinion is even though people understand their rights, the most important question and part of the puzzle for me is the empowerment piece. How can we make sure that people feel safe enough to speak up when they feel like they are being asked to do something unsafe, or when they feel like they do not know how to perform their jobs? Like, for example, we spoke to a few people saying that they felt like, oh, when my language gets a little bit better, or when when I feel a little bit more secure in my job, then I can start talking, I can start speaking up, right? So how do you create an organizational or workplace context that not only awareness, but people are feeling empowered? And I think that is the most important thing. And I wish I had the answer to that question. And I think for researchers, we would like to understand how to what are the factors that can foster that, and also try to understand how employers can work better in a diverse workplace where immigrants are. What are the ways to properly train an individual who's speaking a different language, or who might be coming from with a completely different set of understanding. So just a few things, but I think the puzzle for me is how can we, so it is a very, I think it's to address the systemic issues first, and then also try to understand what kind of interventions or supports can be integrated into the labor market integration of newcomers, so that they can actually know their rights, and then they're able to practice and actualize those rights. Yeah.
Thank you so much, Basak, for this extremely interesting webinar and your great input and expertise on the subject. We truly value you sharing the experiences of recent immigrants and refugees seeking work and the occupational health and safety vulnerability they're exposed to. Thank you for making the time to be with us today. And
thank you so much.
Thank you. And to our audience, thank you for joining.